For Day Above and Beyond, this is the longevity doc, Dr. Nguyen. So I'm here with Don Velasco, and I am actually in Quezon City area. Just flew in last night, and he does a lot of many things, testing, including VO2 max and lactate testing. It seems like you're triathlete of the year 2024.
Yeah.
But the reason I'm here is actually, I talked about in my other videos, is that I think since I had COVID, my cardiorespiratory health has not recovered fully, and I'm gassing out when I'm playing tennis, and when you go up the stairs, it's a little bit of a struggle I'm noticing. So for me to start this journey of getting my health back, I feel that I need to get a baseline VO2 max and then train to get my respiratory health back. So I felt there's no one that does this on long, so I applied all this way here, and it seems like he's one of the foremost experts on this training in your athletic training and your respiratory training on track for athletes, primarily a lot of endurance athletes. So I want to ask Mr. Don, a little bit about your credentials and what you do and what is actually VO2 max testing.
So I'm a multi-sport coach. I've been one for more than a decade already. And this lab, this performance lab, has been around since around 2015. And so far, I've tested close to 3,000. I've done 3,000 tests already. So I've kind of seen the different kinds of athletes that got by. So there are a lot of beginners, there are a lot of elite athletes, and at the same time, there are also people who just want to look at longevity and getting healthy. So, I pretty much understand where you're coming from because you're both an athlete and someone who looks at longevity for the most part. So, the purpose of doing a test like this is because it's an assessment to help guide us in terms of giving you recommendations on what you should be doing throughout the day. So, the first test that we're going to do, or the first half of it rather, is the lactate test. The lactate test will basically profile you in terms of how well you use your aerobic versus your anaerobic system. And this will influence, of course, your performance across different durations of intensity. So, working on your aerobic system will lead towards better endurance. Working on your anaerobic system will lend itself better to explosiveness. And for your sport, which is tennis, it's all about balancing. Right? So you need to have both good endurance and explosiveness. And again, the data that we're going to get from the test will guide you in terms of how hard you need to train, the types of workouts that you need to do, etc. And the second half of it is the metabolic test, or what most people refer to as the VO2 max test. But it actually goes beyond VO2 max. So VO2 max, if you're not familiar with it, is how much oxygen your body can utilize. Right? It's not how big your lungs are, but basically how well your cells are able to utilize oxygen. So it also points towards aerobic respiration, because when we talk about aerobic, it's all about utilizing oxygen. And again, having a high VO2 max usually points to a high fitness level. But it's not always the case. So you can think of it as your ceiling. So if you have a high VO2 max and you're underperforming, then you might be doing something wrong in terms of being specific for the event that you're preparing for. And VO2 max is actually correlated a lot with, as what you said, mortality and basically longevity. So the reason why VO2 max is tied largely with longevity is because it has two components. One is how fit you are, meaning how much oxygen you can utilize, like what I said. And the second one is that it's also determined by weight. So it's divided by weight. So if you have a high weight, you're very heavy, then it's hard to get a high VO2 max. So you could look at it two ways. You need to be both healthy, you need to be fit as well. And I guess the other aspects of VO2 max testing, the reason why we're doing this, is because it also gives you some idea in terms of how well you utilize carbohydrates, how many calories you burn. And this is, of course, important if you want to perform well at a high level for any sport, because you need to fuel, you need to refuel and make sure that you're taking enough calories.
Yeah, so definitely that checks all the objectives I'm here. So just kind of to summarize why I'm here is, number one, to get my cardiorespiratory health back. I feel like I have long COVID, so I'm trying to get that back because it's especially tied with longevity. There's some studies in on JAMA saying that, it was like a cohort study of like 100,000 people, and just going from the 25 percentile at the bottom all the way to anything above average, you can get into there, you cut your all-cause mortality by up to 60 to 70%. So that's in terms of longevity. That's why I want to be here, because I want to live a little bit longer. And on the sports side, my goal is to hopefully be world ranked on the senior master sportsman tennis. So I can't be guessing on the court, so I got to get that back on there to be able to perform and not get stopped. So those are the main things. And then obviously I'm trying to lose some weight as well. So knowing my basal metabolic rate and my calorie and how I burn fats and carbs is going to be essential to planning my nutrition plan too.
Yeah, so all those things are the goals that we're going to aim for. And again, the reason why we're doing this is because we want to make educated decisions and need to be guided by data so that it's a little bit easier to reach your goals. All right, let's get on with this.